Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts. And I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Every other week in this podcast series, we'll share with you the inspiring and heartwarming stories of some of the students and professors who have shaped LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcasts, Google Podcasts, on Spotify, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. It is our Community Health Partnership Day in partnership with Valley Health. So that means we are talking with one of the Valley Health professionals. Today it's Dr. Jeff Fite. He is a return guest on the show. He is the Vice President of Population Health for Valley Health and Chief Medical Officer for Valley Medical Group. Dr. Fite, welcome back to the show. I have to say that one of the shows that we did several months ago was probably one of the most informative shows from a COVID perspective that I have had out of all of the COVID-related segments that I've done so far. So thank you so much for that education.
Thanks very much. Thanks for having me back. I appreciate the opportunity to be with you.
We're going to talk a little bit about COVID and the vaccine and that sort of thing in the second segment of the show. But the big topic that we kind of want to talk about today, at least initially, is the flu, because there's a lot of things swirling around about the flu, and we want to kind of bust a few myths and talk about the flu vaccine.
Sure, happy to.
Start with the flu itself. It varies from year to year. There are different strains of the flu, and this is why you have to get a vaccine every year, because one vaccine isn't going to cover all of the strains of flu. Is that right?
That's exactly right. So seasonal influenza is a different virus than coronavirus, obviously, and it comes every year. It usually gets to our part of the world, late fall, and can last through the winter, and we frequently get a second surge sort of in early March before it fades back away. We see occasional cases throughout the year. And there are some real differences between the flu and coronavirus, even though clinically there's some overlap. So there are going to be a lot of people who aren't sure which disease they might have. I guess we can come back to that in a second. Traditionally, influenza hits people a little differently. Usually it's sudden onset of chills and fever, along with the upper respiratory symptoms, headaches. The body aches are usually really pronounced in influenza. It's got most importantly, a vaccine, which is differently effective from year to year, but broadly effective if everybody gets it. Usually it varies from 50 to 70 or 80% effective based on the year. But again, the benefit is if everybody gets the vaccine, the ability to spread it to others is limited by the fact that so many of the people you come into contact with have gotten the vaccine and they're immune. So we have a vaccine that comes out every year. You do have to get it every year. If you do get influenza, it's important to seek medical attention because the medications that are available to reduce the severity of the illness really work better if you get them in the first 48 hours. If you're a young, healthy person and you choose to just hunker down, that's probably okay. The exception to that is pregnant women who tend to be worse affected by influenza. But if you're someone who's older, has other medical problems, who are at risk from the flu, people die from the flu every year. Not at the same rate as they die from coronavirus, but they do. And so it needs to be taken seriously. And if you are someone who's at risk and you get flu symptoms, please seek medical attention. Please get the medication that reduces the severity and the length of the illness. And then the other things that you can do for the flu are the same things we're recommending for influenza, or for COVID, which is, wearing a mask, keeping a distance. We don't usually say do those things to prevent flu season, but boy, it's going to work.
So you mentioned a second ago, everyone should get the flu vaccine. Is that across the board? Are we talking children to healthy adults to senior citizens? Should everyone really get the flu vaccine?
Everyone really should. And that's not a new recommendation. That's not just because of this season. There are some reasons to emphasize it this year, but the normal recommendation is for everyone above the age of 6 months to get a flu vaccine. And again, the reason for that is people die from the flu. And you can reduce your chances of having a severe case of influenza and subsequent complications by getting a flu vaccine. It's not perfect. We don't live in a perfect world where the shot works 100% of the time. But you have an illness which can be dangerous. You have an illness which you can spread to other people for whom it can be dangerous, and you have the chance to get a vaccine that prevents that. And I think that's a good idea.
Well, it's funny. I've talked to a lot of friends and family members about the flu shot, and some are on both sides of the fence. Some get it religiously every single year. Others say, oh, I got it once and then I got the flu, so I'm never going to get it again. And then in my conversations with the different Valley Health professionals, I've learned that the flu shot doesn't give you the flu. Chances are you were already exposed and were going to get the flu anyway, even before you got the flu shot. So can you help me bust that myth a little bit?
Yeah, thank you. It's one of my favorites. So yeah, two things about that. So it is an inactive virus in the vaccine. You literally can't get influenza. There's no live virus in the vaccine. You cannot get the flu from the flu shot. So what do we make of that story that we've all heard, which is I got the flu shot and I got the flu? Two things. One is vaccines take a little while to work. When you get the shot, it takes weeks to a month to get real immunity. So you're still not immune during that first several weeks after you get the shot. And if you get exposed, you can get influenza. The other is that rarely vaccines in general and influenza vaccines specifically can cause a reaction, which we call serum sickness. It's typically a mild set of symptoms that feel a little bit like the flu. So if you get the flu shot and 2 days later you have a temperature of 100 to 100.2, a little bit of a body ache, you just don't feel great. That does happen with influenza. With the influenza vaccine, but that's not to be confused with influenza. And if you've gotten both, you'll know there's a difference. Influenza is a far more difficult illness. I don't know when last time you had the flu was, but I certainly remember the last time I had it. It is a memorable illness. It is 4 or 5 days of high fevers, body aches, on your back. It is not fun.
The only thing, it's been years since I had the flu. And the thing that I remember, my husband and I both got it at the same time. So if there was a silver lining, it was that we were both laid up together and one of us didn't have to take care of the other because we both got stuck taking care of each other.
And that's when we're young and healthy. For people who are at higher risk, it's not just not fun, but it can be dangerous.
We were talking before we started recording for the radio show. I'm hearing two trains of thought. And one is that flu season may not be as bad this year because we are practicing social distancing and we're wearing a mask, makes it more difficult for the flu to spread. But then the other side of it is that flu season could be more challenging this year. So explain those two lines of thought to me.
Like many of the things we're talking about with coronavirus, it's not one or the other. It's how do these different factors play into each other. So let's sort of split it up a little bit. So on one hand, we should see less influenza this year. It just stands to reason. We have people doing all kinds of things they never do, all of which prevent the spread of the flu. We wear masks. We keep distance. We wash our hands more. We're more careful about our contacts with other people. Influenza spreads the same way coronavirus does. So if we are doing the things that reduce the risk of spreading coronavirus, we should also, by accident or by happy fortune, reduce the spread of influenza. So we should see less flu spread around. When people do get respiratory symptoms this fall, that's going to create some challenges, right? Because getting tested, all the precautions we have to take when we test people for coronavirus, doing those tests outside, reducing exposure for healthcare workers, we've had to create this whole infrastructure around how we want to test people for COVID because of the risks that creates. We have those same risks when we test people for the flu because clinically, it's sometimes hard to tell which is which. If you go to your doctor and you have a fever of 101 and a cough, they're going to want to test you for both illnesses. So I said earlier, you can characterize the flu by certain symptoms, but the truth is, if you were to hang up a Venn diagram of, those circles that overlap of coronavirus and influenza and a bad cold and maybe some allergies, you'd have the Olympic rings, right? These things overlap dramatically. And it's really, I would not want to be a clinician trying to diagnose these things from each other clinically without a test. That's not going to be a reliable thing. And I'm a 20-year experienced doctor. I certainly wouldn't want patients trying to decide which ones they have. It's just going to be very difficult.
So what would you say to someone who's listening now and says, well, wait a minute, Dr. Veit just said that the chances of me getting the flu are less because I'm social distancing and wearing a mask, so I don't need the vaccine. What would you say to that person?
I'd say get the vaccine. And the reason is because we really, really, really want a small flu season this year. So is there going to be less spread? I'm very hopeful that there will be. But less spread combined with a lot of people getting vaccinated will eliminate this confusion that we're having. And so the confusion, the lower the number of people that have to go see their doctors for respiratory symptoms this year is really better for everybody. For the patients, they're going to have to go through all sorts of different channels to get all the tests they need to figure out which illness they have. For the health system, we're going to have some of the, have to manage all through the same challenges. We really all want to work together, like we're working together to reduce the coronavirus incidence. We want to work together to reduce the flu. And we have a vaccine. So you have an illness which is still potentially dangerous, which will create a more chaotic care flow as we get into the winter. I just think it's really wise for everybody to get the flu shot.
And I think the upside to that is in probably 99% of the cases, the flu shot doesn't cost you a dime. You have to pay nothing out of pocket. It's either offered free or your insurance covers it. And you can get it these days pretty much on every street corner. It is not difficult to find a place to get a flu shot nowadays.
That's right. And another thing is as we moved into the late fall, and hopefully we'll have a COVID vaccine sooner rather than later, you don't want to get the two vaccines at the same time. So I actually, for reasons I'm not sure we need to go in here, I typically get my flu shot a little later. The flu shot can wane a little bit as you get into the end of the season. And so I typically get mine, when I was exposed to patients, I'd get mine end of November to be sure that I'm still covered well in March. I don't think you want to do that this year. I think you want to get it sooner. If we have another vaccine in December, you don't want to be taking the two vaccines at the same time. I just think for sort of to keep everybody sort of on the right schedule, all the people who are giving flu shots right now are going to be changing over and giving COVID shots as soon as we have to, we're going to have this massive organizational challenge of trying to vaccinate large populations as soon as we get this supply of vaccine. So being good citizens, taking good care of yourself, trying to help us all work through these shared challenges. I think the sooner people can get their flu shots and we can put that piece behind us, the better off we all are.
So if someone gets the flu shot now in the month of September or even in October, and let's say worst case scenario, a COVID vaccine isn't available until the middle of next year, is there a booster to the flu? Would they be able to, in January or February, get a second flu shot in case theirs does start to kind of wear off a little, or is that really necessary?
We've never done that. I mean, I guess I can imagine a situation where we have a really severe flu season you never know how severe each strain of the flu is going to be too, right? So that's the other unknown. So if we were to end up in a situation where there's a really bad strain of the flu and we start to see people in February who got the flu shot early starting to have it, could we imagine a booster situation? Sure.
That's the good and the bad of medical stuff, is that you don't know until you know what's happening, because you got to wait and see for a lot of these things.
The challenge of the environment that we're working in is that there's a lot of distrust right now, and there's a lot of controversy on every subject. And the truth is that none of these things are perfect, and that really good is still pretty good. And we need to appreciate that things that are 70 or 80 or 90% effective, those are really good things. I think for safety, we need to get closer to 100%. We don't want to be using things that are only 80% safe. I know you want to talk later about the COVID vaccine development. And so I think getting towards 100% on safety really matters. But if something's 100% safe and 70% effective, sign me up.
Let's take a quick break. When we come back, I want to make sure that we touch on the 4 W's. You've mentioned them already, but I want to spell them out a little bit in the next segment. And then can we talk a little bit about the COVID vaccine, what it might look like, why people should get it, and maybe dispel a few myths from the science perspective of that as well?
Sure, happy to.
We're going to take a quick break. When we come back, we're going to continue our conversation today with Dr. Jeff Feit. He is the Vice President of Population Health for Valley Health and Chief Medical Officer for Valley Medical Group. This is part of our Community Health Series in partnership with Valley Health. I'm Janet Michael. You're listening to The Valley Today, and we'll be back in just a couple of minutes.
Do you know anyone who is struggling with financial hardships because of coronavirus? Our new webinar called Coping with the Money Crunch can help. We'll talk about immediate options to consider, revising or creating a spending plan, and lots of community resources. Then we'll cover how to narrow your priorities, contact creditors, and avoid scams and risky loans. The webinar is free, and you can either join by phone or through Zoom on a smartphone, tablet, or computer. You can find out more by visiting the Northern Shenandoah Valley Financial Education Program on Facebook or calling Karen Poff at 540-635-4549. Let me show you how to make your own plan or help someone you care about get through the crisis. Call 635-4549 or visit @NSV Financial Education on Facebook today.
Welcome back to the Valley today. I am your host, Janet Michael. It is Community Health Partnership Day. You, of course, are listening to it on a Thursday afternoon. We have pre-recorded our conversation on a Monday morning so that we could chat with Dr. Jeff Veit. He is the Vice President of Population Health for Valley Health and Chief Medical Officer for Valley Medical Group. And in the first segment, Dr. Veit, we talked a good bit about the flu, and I'm sure we'll touch on it a little bit more in this segment, but this segment's going to be a little bit more COVID related. As a physician, as someone who is in charge of population health, you have probably kept a really close eye on the numbers in the Lord Fairfax Health District, and I think we've done okay as far as positive tests and infections, haven't we?
Yeah, especially recently. So in the beginning, we had a fair number of outbreaks in some of our nursing homes, some of which were really tragic. And over the last, I would say, 3 months, there has been an enormous partnership between the community, including the health department. Dr. Green and his crew is just, I can't say enough about the work they've done. The health system, Valley Health, has been meeting regularly, both internally and externally, to figure out how to be a good partner. Shenandoah University and other businesses that have congregate living, working with the homeless community, working with other businesses and government officials. There really has been a wonderful cooperation in order to understand that this is a shared challenge and one that none of us can meet independently. And I've just been overwhelmingly impressed at how the community has come together and worked together. Things could change tomorrow, and we're all knocking on wood, and nobody wants to take a victory lap. But one of my mentors used to say, chance favors the prepared mind. And there's a lot of prepared minds around here. There's a lot of folks who have done tremendously important work to be ready to be as safe as possible, to understand the science. Not everybody who's been doing this work spent the last 20 years of their life trying to understand virology and epidemiology. And so there's been a lot of learning. And so just feel really fortunate to live in a community where people work so well together and where everybody is so committed to the successes we've seen.
I think sometimes small communities like ours, up and down the Shenandoah Valley get a bad rap because, you're just a tiny little community. But in these sorts of situations, that really does play a large role because you are able to pull those partnerships together.
That's right. And this is a really special sized community in that regard. We're big enough to have resources. We're not super rural where it's just really hard to find the right resources to do this. We have human capital in terms of people who are able to coordinate and set up these sorts of things. And we have financial resources to be able to do things. We have an amazing health system that's able to support things. And we're really blessed to have a tremendously effective health department. People who have worked, I can't tell you how many hours to ensure that we're doing the best we can and staying safe. So it's just been a great experience working with everyone, trying to keep everybody safe.
In the first segment, we talked about the flu and getting the flu shot, and we touched briefly on the COVID-19 vaccine. And of course, the hope is that something will be available by the end of this year, early next. Walk me through that process in regular people speak.
This is really important. So I'm gonna do a quick aside. So there's been some news in the last couple of weeks about convalescent plasma, the idea that you get other people's plasma who've had the illness and you can get the antibodies from them, and that is really effective at reducing mortality from COVID. And that's true. But the story is more important. The story is that we got initial reports really early on that convalescent plasma works, and then we did some trials and it didn't work. And then the scientists say, wait a minute, what's that about? And they tweaked the protocol. And they found that if you use a higher concentration of antibodies and treat really sick people, it does work. And it works a lot. And that's normal science. Normal science includes create a protocol, understand the results, tweak the protocol, do it again. Normal science is a time-tested way that we learn as a society and create interventions that are safe and effective. That needs to be the rule for the vaccine development. We have a way of developing vaccines in this country that we've used effectively for many, many years. And not just vaccines, but all medications. They go through different phases of research, and I won't get into the minutiae of what those phases are, but it's important they go through all three phases. And by the end of phase 3, the intervention, in this case a vaccine, has been exposed to 30,000 people. And they're people that are not chosen completely randomly. We want different demographics. And we want to be sure that it's safe and that it's effective. And safety is, in this case, is probably more important than efficacy, like I alluded to earlier. Give me something that's 100% safe and 75% effective and sign me up. So people ask me, will you take the vaccine when it comes out? And I feel like the only possible answer right now is, well, it depends. If it comes out having gone through normal science, the answer is absolutely. Absolutely. And there are some really legitimate ways that we can speed up normal science. In other words, right now, the government has spent billions of dollars prepaying companies to produce vaccine that may not work and that may not be safe. And they need to be willing to throw it out if that's true. But if one of those 3 vaccines, there's 3 that are really in these late stage phase 3 trials, if any 1 or 2 of those 3 comes through phase 3 normal process trials, and the other scientists look at that data and say this is safe and effective, then we will have sped up the process by 6 months because it's already produced. That's where you save the time. You can't save the time shortcutting the science. You save the time doing parallel processing and making the vaccine and figuring out the delivery network while you're still doing the studies, understanding that 1 or 2 or all 3 of them might fail. So I think if I answer the question, will I take it today, I'm falling into the trap. The answer is we need to insist on normal scientific process. We need to insist that the voices that matter relative to approval are the scientists and the doctors, the people who do this for a living every day. And if they, represented in our cultural milieu today by Tony Fauci, if Tony Fauci says it's okay. No, but if the people who do this,
hey, I said that to you during the break. If Tony Fauci tells me to get that vaccine, I am first in line.
Dr. Fauci wrote the textbook, so he gets a lot of credit. So if those folks come out and say this was normal process, we were unhindered and unbothered and uninfluenced in our work, and these are our results, and they are positive, and we do the normal peer review where 20 of their peers look at it and go, yup, I've seen the data and this looks good, then I think we should all feel good taking it. And if any of those things aren't true, then I think there's going to be more skepticism. And again, by skepticism, I don't want you to overread that. I think if it goes through some sort of, if we see a huge spike in the fall and tens of thousands of people are dying, and we have a vaccine that's gone through most of phase 3, and somebody says, hey, we just can't wait any longer. Let's roll out the data we have today. And that gets peer reviewed. Again, understanding that now we're not using normal process, but we're doing the best we can, then we'll have to evaluate what those experts say when that happens. But it really has to be the peers of the scientists. It has to be other scientists who are not directly doing the work, who look at the work of these experts and say, this is good work, this is good science, this is a good vaccine. I think that's what's going to breed confidence. And I think the more we deviate from that normal process, the more folks are going to say, this is political, this is economic, this is whatever. So I'm going to double down on the scientists. They've served us well for a really long time.
So before we wrap up, can we cover the 4 W's one more time, just so, because people are probably sick of hearing it, but there's still the chance that we're going to get through to that one more person who is only doing one of the 4 W's, and they really need to do all 4. What are they?
Wash your hands, watch your distance, wear a mask, and as you said earlier, there's so many places to get a vaccine that I'm not sure we can use work with your doctor to get a vaccine. So work hard to get a vaccine. How's that?
That's perfect. So there's a list on valleyhealthlink.com/flu that's going to have a list of places where people can go to get the flu shot. So, you can't make it much easier than that, I think.
That's right. And they're free at the health department. And please go to that website and look for a place to get your flu shot. And again, please try to get it early if and when we do have a vaccine and we have great faith in it later this fall, which is my great hope. It'll be great if everybody's already gotten their flu shot. And one thing I didn't say earlier, but everybody should realize is there is also the small chance that folks could get influenza and coronavirus together. And we haven't seen that because we haven't had a flu season during the coronavirus pandemic. But it would stand to logic that you don't want that combination of illnesses at the same time.
Oh, yeah, I could not even begin to imagine how horrible that could be. Well, Dr. White, thank you so much for taking some time today to explain this. I assume that I can pencil you in for closer to the end of the year and have another whole vaccine conversation about COVID. Does that work for you?
Anytime. Happy to do it.
We are going to wrap up our conversation today with Dr. Jeff Veit. He is the Vice President of Population Health for Valley Health and Chief Medical Officer for Valley Medical Group. This has been part of our community health partnership with Valley Health. If you've missed any of those conversations, go to theriver953.com/Valley Health Podcast. And every conversation I've had with every doctor, administrator, mental health professional is listed there. I will be back tomorrow. I'll have a brand new episode of The Valley Today for you. It's a much more lighthearted topic tomorrow. We're talking fall lawn care. So meet me and Mark Sutphin back here tomorrow a few minutes after noon, and we will have that conversation ready to go for you.